Good afternoon. I'm here with Dr. Chant. I'd like to thank our operating interpreter for assisting us this afternoon. Reflecting what is happening worldwide, and obviously an increasing number of people are being diagnosed with the novel coronavirus. What we are now seeing in Sydney, New South Wales, is reflecting that situation. As at last Friday, or Thursday, late last week, we had just 4 people, and of course they all been discharged. By the weekend, that had increased to 9, and earlier today, in fact only about an hour ago, the Premier announced the 10th person to have been diagnosed with the virus. And then I found Chant and the health authorities advised me of the 11th. I have just been advised of the 12th and 13th. So we are seeing quite an escalation of diagnoses of the virus. Having said that, the people who have been diagnosed in the last little while today, in the latest pathology runs, have all had a fairly positive position in the sense that they were diagnosed in the early stages. Obviously, I just preface this by saying this is all hot off the press, literally, but we believe that they first presented to their GPs, and they were then able to have their pathology, those pathology results have come through literally just in the last little while. The people who we have had this afternoon, I'll just give a very brief summary, then I'll pass it to Chant who will have some more things to say on this. We had, as we announced in Parliament this afternoon, as the Premier announced, a 39-year-old gentleman who came in from Iran on the 28th of February. And he came via Kuala Lumpur and Singapore. We have another male who was 53 years old, and he returned to Sydney from Singapore last Friday, that's the 28th of February. And the 2 cases that have literally just been advised to us from pathology, and we're very, very light on detail at this point, but we will make that further information available as soon as we can. We have a female in her 60s who returned to Sydney from South Korea and was diagnosed today. We don't have full details yet of when she returned to Sydney or what the flight details were. And the case number 13 is a female also in her 60s who returned from Japan, and again was diagnosed today. So we are seeing an escalating in the number of people. But can I say this, and I say this very much to the community more broadly who are coming back into Australia on some of the many now hotspots around the world. These people should be thanked, and as the Health Minister here in New South Wales, and I'm sure Dr. Chant, we both thank them for putting themselves forward when they recognised that they had certain flu-like symptoms, and they presented themselves to generally at the moment general practitioners, but in some cases they presented to hospitals, some of the early ones, and that is absolutely critical. New South Wales Health, indeed the health systems around this country, cannot do this job that we need to do without full partnership with the community members who are coming back from these locations around the world that unfortunately do have the novel coronavirus so prevalent. We do have some important events coming up in some of the communities. March 20th, there's quite a number of communities, including the Iranian community, the Azerbaijan community, quite a number of communities will be celebrating New Year, and there will be large celebrations anticipated. New South Wales Health will be working with the communities over the next week or so just to work out how best to handle each of those events to make sure that we enjoy but also done safely. I'm going to ask Dr. Chant if she'd like to add some more to the details of what we've got and how we are currently managing. Dr. Chant.
So as expected, that these are returning travellers that we've announced today. We will be releasing to the press the details of their flight details and any seating information and any specific rows that we would be asking them to self-isolate themselves. As you can understand, we just want to verify those numbers and don't want to misread them in this media conference, but we will be issuing that as soon as we can after this conference. I'd just like to echo the Minister's comments that really the fact that we're able to detect these cases means that they have been isolated and their risk on transmitting it within the community is reduced. So I would actually like to thank these individuals for coming forward for testing and acknowledge the fact that the community is heeding our calls for vigilance in returning travellers and to go forth and seek advice about the need for testing. Thank you, Minister.
So happy to take any questions now. I just emphasise that because these new cases are literally just come to our attention from the pathology laboratories in the last hour or so, we are scant on all details, but in the same way that New South Wales Health, particularly Dr. Chant and her team, have been making transparent all the information that comes to us, we'll certainly make it public as soon as we're aware of it, and particularly for the reasons that what Health is now doing, having received the information as to these particular individuals, they then follow a practice of identifying those with whom they have come into contact, and particularly those who may have been seated immediately near them or within a reasonable vicinity of them on the aeroplane flights. Each one of them did enter Australia by air. So that just needs work between New South Wales Health and also the federal authorities, particularly in regard to who might have been on those particular flights and what airlines they were on and so on. So any questions?
Can we just ask about the health worker
Sure.
we learned of yesterday who's infected? Can we confirm that they were a doctor, and are you able to say where they've been working and whether you've contacted other patients who come into their care?
Thank you also again to the media for your partnership in making sure that we're able to get this information out to the community at an appropriate time. Yesterday, in regard to the 53-year-old doctor, was not an appropriate time, but today we consider that it is, although subject of course to the overriding position that we must at all times respect individuals' privacy, as each one of us would expect if we were in a medical condition, we would want our privacy safeguarded. But I can say in a broader public context that the doctor was working at the Ryde Hospital here in Sydney, and New South Wales Health has been working very hard to establish which staff were in close proximity to the doctor, and also which patients. And at this point, I think that's progressing quite well. Their tracking is going quite well, but there's some more work to do.
And what sort of patients was that doctor coming into contact with? What was the doctor's, I guess, role within the hospital system there? So what sorts of patients would he be dealing with?
I know the answer to that, but I'm not sure whether that would traverse into his privacy. So I'm going to ask Dr. Chant. I will actually. What do you think, Dr. Chant? I'll let you take that.
Look, I think
make that decision.
I think he's seen the patients which reflect the usual sort of patients we have, which is a diverse range of patients in our system. I think what's most important is that actions already occurred to promptly identify those staff members, and a number of them have been close contacts, have been ceased work and are under precautionary isolation and are no longer attending the workplace. And then we're progressively bringing the patients that were seen by this doctor to inform them. For some of them, it will be, depending on when they've seen him, in 14 days have passed and they've remained well, we can give them a reassuring message. So the message has to be tailored for each individual patient and when they were exposed what the health advice is.
Was he in the emergency or in another section of the hospital?
He is in Ryde Hospital seeing patients. He was in Ryde Hospital seeing patients. I think it's really important that we don't have a disincentive for people to come forward to seek health care, and I'm really conscious of managing the privacy. So I think if I can just be open and say he's a doctor at Ryde Hospital, we are openly contacting all of the patients that he has seen, and we have contacted close staff members of him. And I would just think that that's probably unnecessary for additional information about where he's working for the purposes of public health.
So what's those that he's come in contact with, what's the procedure? If they haven't got symptoms at this stage, what are you telling them?
So it depends on the time frame. So if they were in contact with him and 14 days have elapsed from their last contact and they've remained well, then they can be given the all clear. If they had any symptoms, then obviously we will investigate those and exclude COVID-19. And then if patients had seen him more frequently and haven't passed that 14 days, we would ask them to self-isolate and to take precautions and be self-monitor for any onset of symptoms. So the advice has to be tailored depending on the nature of the exposure with the particular individual. And it's great that we do actually have medical records where they can be reviewed and the documentation can be reviewed on that. So we'll have quite good information on who that doctor saw and the nature of the contact.
And nobody in quarantine at this stage?
Sorry?
Nobody's in quarantine at this
The
stage?
healthcare workers are
in
quarantine, as are the patients progressively, but as I said, it's not a blanket message if they're beyond the 14 days, and so it will be a case-by-case assessment, and we will be acting in accordance with the national guidelines, but just depending on when he was seen by those individuals. Obviously, we're taking an incredibly precautionary approach, and there is some information that's unclear about the exact time this doctor became unwell, because often you can have some symptoms that commence sometime, you can get a bit better and get sick. We've taken a very precautionary approach to this, to the contact tracing around this case.
So
How
Dr.
many
Chant, are you
patients do you-
concerned that he may have been working when he was sick before he realised he had coronavirus?
We're always conscious of the risk of transmission, and as I said, it's sometimes hard because, as I've indicated, the symptoms can be quite mild at times, and it may be that he wasn't aware of his illness, or this wouldn't have been expected. He also hadn't travelled recently, so to some extent it is probably unlikely that that would have been a diagnosis he considered. And so I think we need to remember that, because this is a case where there isn't, his diagnosis is not linked to overseas travel. We still don't know how he acquired the infection. The two scenarios are obviously community exposure or within the workplace, and we are doing an investigation as we speak about whether the doctor may have interacted. He's certainly interacted with no known coronavirus patients, so he did not care for any of our positive cases, but we are doing some additional investigation to review what patients he saw, just to ascertain whether there was any undiagnosed patients amongst that group. Obviously that's challenging, but we are undertaking that, and we will certainly update you with that information, because it's very important information.
What sort of rough number are you looking at in terms of how many patients you think you may have come into contact with in that period? So roughly how many people you might need to get in touch with?
Look, we'll provide an update on the progress we've made and the number of patients afterwards, but he certainly would have encountered a large number of patients, but in the release that's updating with the airlines, we'll also give an indicative number of patients and also an indicative number of staff.
So just to be clear, in New South Wales now, we've had in Parliament some information, you've got some information. Can you just tell us how many cases have you got in New South Wales now, and how many new ones today?
Okay, so we have 13 cases in total of novel COVID-19, and there were four cases that we've announced today.
Dr. Chant, are all the patients you're contacting in relation to this doctor Ryde Hospital patients?
Yes, that's my understanding.
And sorry, just to confirm, so we're not quite sure how this doctor got coronavirus yet, but is it likely that he could have got it through a patient and stuff?
So the two, at the moment is totally unknown. So the two sources, in the absence of overseas travel, we have to keep an open mind about exposure within the broader community. Having said that, there is no family member, his family members and close contacts remain well, so that's probably excluded as a source. There is, but he could have had other community exposures, they're being investigated, as well as healthcare worker exposure as a healthcare worker. We're investigating all avenues, and we'll update you as we find any information that will lead us in one direction or the other.
Can you tell us, I'm sorry,
Yep.
can you tell us how many of his colleagues are quarantined? Is that leading to the staff shortage at the Right Hospital?
There has been staff surge overnight to ensure that there is adequate staffing. So all I can confirm is that there's adequate staffing, and in the press release we will give you a summary of the number of healthcare workers that have been put in off work as associated due to their contact with this
So if you
individual.
can't narrow down who he's had contact with and where he got it from, you could have a case of a missed case somewhere in the community, couldn't you?
I think that we have to be frank that it's always anticipated that no system of getting people to come forward and test is any absolute. I think what we know though is if we can actually identify the majority of cases, we can still very much slow and dampen down any ongoing transmission. So I'm actually pleased today that I'm announcing the 4 cases in one way, because I think with the evolving situation overseas, it gives me confidence that people are presenting to GPs, our GPs are knowing what to do with them to undergo the testing, and we are finding those cases. If they were undiagnosed, then they were potentially at risk of transmitting it further in the community. So for me, I just go back to it. Thank you to the GPs who undertook the testing, and thank you to these patients who recognised they were at higher risk and have come forward for testing.
Can you just confirm what quarantine actually means for these patients and these healthcare workers?
So the normal quarantine provisions is that we basically self-isolate, so close contacts of a confirmed case self-isolate. That means that you can stay at home, but you can't, we give you instructions which are on our website about how do you minimise your contact with anyone else in the household. We also, you can go out to your backyard, you can walk in the street, but you can't come in close contact with individuals that would put any member of the public at risk.
Just as a rough estimate, how many patients would be in isolation?
As I said, we're working through each of the patients to confirm their status, and we will update that in the press release.
Dr. Chant, the doctor was last checked when he was in ICU. How is his health now? Is it improving or is it the same? Obviously the fact that he's in ICU is cause for some concern for his health.
Look, I haven't received an update on his condition this afternoon, but speaking to a clinician this morning, his condition was stable. But again, in the press release we can update that. But obviously, again, we have to be cautious about protecting his privacy in relation to information that he would be happy to have disclosed to the media.
Can I just ask about the patient who was on yesterday's information on the Qatar Airway flight? Are they infected?
Yes, that case was a confirmed case that we mentioned yesterday, and we have released details in that press release from yesterday around the seat numbers and the details for the contact tracing on that plane.
And if there's contact with everyone on that flight who may
So
have been
we are
infected?
awaiting the details for those individuals. Some people have read your media, and so that's why it's really effective for us to get out that flight details and why we want it to be accurate, and contacted us. But in due course, when we get any information that allows us to contact anyone, we will be prioritising that, but we're also relying on the media to get the message out.
Are you frustrated that, is it correct, and if it is, are you frustrated about the information not coming from Border Force with the contact details for those fellow passengers?
Look, I think we would obviously like to work closely with the Commonwealth Government on how we can streamline access to this information. This event has highlighted the importance of getting that information, and I'm keen to work with our colleagues in the Commonwealth to look at how we could streamline access.
What are they telling you? What's the problem?
So the issue is twofold. It's both an issue with individuals, and I suppose I've said this in previous press conferences, is when you complete your cards, I think we do it at the end of a long flight. We're not anticipating that really anyone needs to contact us, and so we write illegible numbers. We write no area code for mobile phones, and so a lot of the contact details when we get the cards from Border Force are impossible. We're very sloppy with the way we write even emails, and then when people are travelling, sometimes they don't even check their email regularly. So these are considerations, and I think it's really important that travellers actually understand that those documents are there for important reasons should we need to contact people. The second issue is obviously it takes time for the Border Force to pull those cards, and I think we would be pleased to see a more electronic transfer of that information or an automation. We acknowledge the challenges that Border Force currently have, but it is critical information, and it would be good to see that transmitted in a more streamlined. So two issues, both an individual issue but an issue about the technology.
And what plans are in place to quarantine ICU beds for coronavirus patients?
So we don't quarantine ICU beds. What we have is a system where we are planning to surge our ICU beds. And
what does that mean?
So it means that we have requested that our services plan for increasing their ICU capacity, and that currently that work is being undertaken with our districts to actually do that. And we can do that. We can put up ICUs into perioperative areas. We can redeploy staff from that are potentially anaesthetic staff, or have other surge strategies for staff. So I'm not saying it's not a challenge, but we have done a lot of extensive planning about how we would surge our ICUs.
Is that across the board? Is that just in Westmead, or is that across the board?
That's across the board. So
hospitals?
if we were needing to surge our ICU capacity, it would be across the board. And this is prudent planning should we have community transmission and it is causing a significant impact. It is important to know that our objective of our healthcare system is always to treat everyone proportionate to their outcome. And so we would be managing entry to ICU on those that will benefit from ICU admission, and irrespective of COVID, whether you've got COVID-19 or you're a trauma or you've got any other reason why you're going into ICU, it's important that your clinical criterion are used for assessing your entry into ICU.
What plans are in place to delay elective surgery? When will that happen?
Elective surgery is one of the strategies that we can deploy to give more capacity to respond to a surge in demand. Those decisions will be made as we see the impact hit and adjusted. So we have a very centralised management system. There will be daily contact with all of our health facilities led by the DepSec of system performance, and we will be making those decisions when that is required. We won't be turning it off too soon because we obviously want to make sure people get access to elective surgery, but that is a strategy, and we know that some surgery particularly needs recovery in ICU, so when we have a peak demand, it may be some of that surgery that requires a few days in ICU might be turned off just for a short period of time to allow our ICUs to flex. So we have a range of well-developed strategies.
We had a attempt that Northern Beaches Hospital had a confirmed coronavirus case that had been formally announced yet.
No, I can confirm that there is no positive. We have provided advice on all of the positive coronavirus cases, and that the testing is only done in 2 laboratories at Westmead and Randwick, and we know about all cases.
Just a question for the Health Minister. The Chief Medical Officer has said today that there's no need for the broader community to stop shaking hands, which contradicts your comments yesterday. Sorry?
I'm sorry, what did you say?
The Chief Medical Officer has said today that there's no need for people to stop shaking hands, which is in contradiction of your comments from yesterday.
Well, I think there's a range of views, medical views, but certainly comments that I made yesterday were in consultation with Dr. Chant, and we were talking about how it would best to try and avoid passing on the virus. So The Federal Health Officer might have a view, but there are a range of views, as you'd expect in professions, and I've expressed a view which I adhere to strongly, and that is this virus is quite capable now, we know, of being transmitted, and the community would be well advised to take all steps necessary to ensure that they don't have transmission. As I said, there are a range of expert views. Some of those expert views talk about the fact that COVID-19, as with other coronaviruses, well in fact it was off the earlier coronaviruses, are capable of existing on hard surfaces for 2 to 3 days, so it makes sense to do everything possible to ensure that you're not going to be in any way affected by that virus. But I also say that we should stress, and I stress this very much, that whilst we are seeing an increase in the number of people who are both coming forward and then being identified with COVID-19, these people are generally doing reasonably well. Their presentation can be on very mild symptoms, and in fact the early information we have on the 4 latest cases today are that they came through GPs. They were very sensible. They went and saw their GP, and their GP arranged the necessary pathology, and they went home and they self-isolated, and there will now be consideration of what level of medical care is required, but they're actually doing quite well. And as Dr. Chant was just highlighting, on a clinical basis, and it's very important we recognise all these issues on a clinical basis, that the patients may not require ICU treatment. That may be reserved for particular patients with particular issues. So, and overall, the world experience to date with this particular novel version of the coronavirus is that around about 80% of people have fairly mild symptoms and recover very well. It tends to be those people over the age of 65 who have comorbidities. In other words, they might have diabetes or pulmonary issues or lung issues that are not doing so well. So it certainly is a case of it's good news that people are coming forward, and it's good news that so many people are coming forward with quite mild symptoms. And that's fairly typical of these sorts of coronaviruses as they've developed. It shouldn't be forgotten that we've had varieties of coronavirus, SARS and MERS and other situations in past years. And of course we've dealt with them appropriately as a community, and I'm quite sure that we will deal with this appropriately. We have an amazing health system here in this country, and once you're in the care of our doctors and nurses, you are extremely well cared for. So my message to the community is be cautious, but don't be alarmed. If you do have some symptoms, flu-like symptoms, do what we've been talking about the last few days. You're coughing and sneezing, preferably don't use your hand, cough into your elbow, and if you have any concerns at all, contact your GP or contact your emergency department, particularly if you've got flu-like symptoms and have had some connection with some of the hotspots around the world for coronavirus, or you know and have been near somebody with coronavirus here in our country. And you'll be extremely well looked after, and I would just encourage people to keep coming forward. We're very grateful for it. And I would also say to people, again, there's a variety of medical views, but good old sensible advice is don't shake hands and be cautious who you kiss.
Can I just ask, the normal flu season, we're getting into cooler weather now, but when does that start to ramp up, and will that cause confusion?
What we're particularly concerned about at the moment is not just obviously the coronavirus, COVID-19, but normally by around about April, May, we see our normal flu season come on, and that's why we've been, in fact yesterday, announced that it seems to be lost a little bit in the overall coronavirus issue. The government announced that we were extending pharmacists' capacity to provide flu injections, flu vaccinations to young people below the current age, which is 16, right down to 10. And that's a focus that we've got, particularly in concert with Dr. Chant and her team, on the fact that we're trying to minimise any impact, the potential dual impact of exposing people to the flu and the COVID-19 virus. Now, the flu vaccination is not a vaccination for COVID-19, but it does actually build your resilience against the coronavirus, the COVID-19 virus, and that's helpful if you're then going to have to deal with the COVID virus. So if you take your flu shots, in other words, have your flu shots, that's going to help your resilience to your body generally, and that would help in trying to deal with the novel coronavirus that's now circulating in our community. And on that, I thank you all yet again for your very strong support. I can't tell you how important it is that we have the media continue to have the interest and to work with us to get the messages out. And also, as Health Minister in New South Wales, I just want to thank Dr. Chant, and her team, who have been working immeasurably long hours now for quite some weeks. I've seen them back in here in this office back to 11 o'clock at night, sometimes later. Just thank you to you, Dr. Chant, and all your team, and all the doctors and nurses across New South Wales, and particularly in our hospitals and our general practitioners who are so alert to the possibility now of the COVID-19 virus. And thank you for the work you're doing.
Sorry, just one more minute question. Sorry. Are you aware of any outbreak at Wiltshire Hospital?
No, you mean kind of like
COVID-19? Yeah.
No, I'm not aware of any COVID-19 outbreak. And I really appreciate the fact that you check with us before you do that, because we have been seeing quite a lot of misinformation, and it actually causes distress and can actually cause harm. So thank you very much for that. I'd also just like to highlight that we very much are aware of the fact that we might see influenza with COVID-19. So overall, what we're trying to do is manage, influenza is actually a serious illness as well. And this is an opportunity to both optimise our management of influenza and prevent the impact on that, on the community impact of that, at the same time as we're trying to reduce the community impact of COVID-19. So it is important that we urge people to get vaccinated. We will be pushing that. The vaccine's not available yet in the public supplies until in April, but we do urge you to get vaccinated. And the simple messages around that we're giving out now are just common sense. They will just reduce the risk of respiratory viruses in general. If we did this all the time, you'd probably see less flu in summer, less flu in winter, and less respiratory viruses transmitted. And often we see these challenges actually bring us out and changes the way we interact. I think, if I recall now, the messaging after we went through 2009 H1N1, we saw a lot more availability of hand wash, a lot more messages in our healthcare facilities. And so that these sort of things become basic and normalised. And so now's a really good opportunity to really get that awareness embedded about the role the community will play in stopping the transmission of respiratory viruses.
Do you anticipate, though, your emergency department's going to be even more overwhelmed in the flu season ahead with this extra load?
Absolutely, and we've actually asked our emergency departments to take into account that the peak of activity of COVID-19 may occur at the same time. And it won't be just the solution of our emergency departments, it will be a whole of hospital response, and we will also be needing to work very much in partnership with GPs and also, I'd say, our pharmacists as well, and we've had some productive conversations with the group around how we can support people. We will be very much, if we get sustained community transmission and have a large number of cases, our messaging will change, where we won't be wanting people to come forward with very mild disease. We will be messaging to people with very mild disease. If having a diagnosis of COVID-19 or influenza won't change how you're managed, just do what you would normally do. Self-isolate, take medication for your fever, control your symptoms, isolate yourself so you're not infecting others, work from home if you feel up to it. But those simple our messaging will change depending on the phase.
And what about the hospital staff and taking leave? Are there any plans in place regarding that issue?
We're currently looking at that, but obviously, as you would expect us to do, is if you are planning for surge planning, you have to take into account some of those basic issues of your staffing, how you're going to get and increase your staffing capacity, and also the issues of non-essential leave.
Finally, can I just say to everybody out there, when you think you've washed your hands enough, you've just started. Double it and triple it, because just washing your hands many times during the day will be a major step forward in stopping the transmission of all viruses, flu virus, COVID-19 virus, and I thank you again for all your interest very much.
Thank you.
Thank you.